People believe that more medical screening is always better. More tests, more scans, more procedures, more peace of mind. But here's what nobody tells you after the age of 60. Some medical screenings can provide valuable information, while others may lead to unnecessary worry, additional testing, unexpected complications, or treatments that may never have been needed in the first place. Over the past 25 years as a physician, I've seen many older adults assume that every recommended screening automatically improves health outcomes. Sometimes it does. But sometimes the situation is far more complicated. The goal isn't to avoid medical care. The goal is to receive the right care at the right time for the right reason. And that's exactly what we're going to discuss today. 5 medical screenings that may not always provide the benefits people expect after age 60, depending on their overall health, personal risk factors, and life expectancy.
I'm Dr. Williams, and for more than 2 decades, I've worked with older adults facing a wide range of health challenges. One of the most important lessons I've learned is that good medicine is not about doing more. It's about doing what is most likely to help. I've met patients who underwent extensive testing only to discover findings that never would have caused problems. I've also met patients who benefited greatly from screening because it was targeted to their individual risks. The difference often comes down to understanding the balance between benefits and harms. Before we discuss specific screenings, it's important to understand a concept many people never hear about. Imagine your home has a highly sensitive smoke detector. A good smoke detector can warn you about danger, but if it's too sensitive, it may constantly go off when there's no real threat. Medical screenings can work the same way.
They are designed to find disease early, but sometimes they find abnormalities that would never have caused symptoms or shortened a person's life. This can lead to what doctors call overdiagnosis. Once something is found, it's often difficult to ignore. Additional scans, biopsies, procedures, and anxiety can follow. That's why modern medicine increasingly focuses not only on detecting disease, but also on avoiding unnecessary interventions. Let's begin with prostate cancer screening using PSA blood tests in older men. Many men believe annual PSA testing is always necessary. After all, prostate cancer is common, and early detection sounds like a good idea. There is certainly value in screening for some individuals. However, the situation becomes more complicated as men get older. In many cases, prostate cancers grow very slowly. Some men may live for years without symptoms from these cancers.
Yet an elevated PSA can trigger biopsies, repeat testing, and treatments that carry risks, such as urinary problems or sexual side effects. I've had patients become extremely anxious over mildly elevated PSA levels, only to learn later that nothing dangerous was occurring. The key question becomes whether screening is likely to improve quality or length of life based on the individual's overall health. Have you ever had a test result create more worry than answers? The next screening may surprise you. Whole body scans, marketed directly to consumers, have become increasingly popular. Many people view them as a way to catch hidden diseases before symptoms appear. The idea sounds appealing. Who wouldn't want to know if something is wrong? But here's where things become interesting. Whole body scans frequently detect small abnormalities that turn out to be harmless. These incidental findings can lead to additional imaging, invasive procedures, and months of uncertainty. I once treated a healthy retired teacher who underwent a private screening scan.
A tiny abnormality was found. What followed were multiple appointments, additional scans, and significant stress. In the end, the finding was completely benign. The experience taught her an important lesson. More information isn't always better information. Were you aware that some scans can uncover problems that never actually become problems? Now let's discuss screening for carotid artery narrowing in people without symptoms. The carotid arteries in the neck help supply blood to the brain. Because strokes are a major concern, some people assume routine screening for blockage is always beneficial. The intention is understandable. Everyone wants to reduce stroke risk. However, for people who have no symptoms and no specific risk factors, routine screening may identify mild narrowing that never causes harm. Additional testing or procedures may then follow, each carrying its own risks.
The better approach often involves focusing on proven stroke prevention strategies, such as controlling blood pressure, managing cholesterol, staying physically active, and avoiding smoking. Small daily habits often protect the brain far more effectively than chasing every possible abnormality on a test. Did that surprise you? The fourth screening involves certain forms of osteoporosis testing that are repeated more frequently than necessary. Bone health is extremely important after 60. Fractures can significantly affect independence and quality of life. Bone density testing absolutely has value when used appropriately. The issue arises when individuals with stable results undergo testing too often without a clear medical reason. Repeated testing may create confusion without changing treatment decisions. I remember a patient who arrived with years of bone density reports. She had become convinced that tiny changes from one test to another meant her bones were rapidly deteriorating. In reality, the differences were well within expected measurement variation. Once we reviewed her results carefully, much of her anxiety disappeared. Sometimes the best medicine is understanding what a test can and cannot tell us. Have you ever worried about a number without knowing whether it truly mattered? The fifth screening is one that often generates strong opinions: cancer screening in very advanced age. Cancer screening has saved lives and remains incredibly important for many adults. However, the benefits of certain screenings may diminish for some individuals as they grow older, especially if they have serious chronic illnesses or limited life expectancy. This doesn't mean screening should stop automatically at a specific birthday. Rather, decisions should become more personalized. I've had conversations with patients in their late 70s, 80s, and beyond who assumed they should continue every screening indefinitely. Sometimes continuing made sense. Other times, the potential harms outweighed the likely benefits. The goal was never to deny care. The goal was to align medical decisions with the person's overall health, priorities, and goals for the future. What matters most to you? Finding every possible abnormality, or focusing on tests most likely to improve your quality of life? But that's only part of the story. There's another issue that deserves attention. Many people think screening tests provide certainty. They don't. Every test has limitations. Some produce false positives. Others miss disease entirely. This doesn't mean screenings are bad. It simply means they are tools, and every tool works best when used appropriately. Understanding this can help reduce fear and encourage better conversations with healthcare professionals. So what practical steps can you take? Start by asking a few simple questions before agreeing to any screening. What is this test looking for? How likely am I to benefit from it? What happens if the result is abnormal? Could additional testing cause harm? How does my age, health status, and family history affect the decision? These questions often lead to more meaningful discussions than simply asking whether a test is recommended. I also encourage viewers to focus on preventive measures that consistently provide benefits. Regular physical activity, healthy nutrition, quality sleep, blood pressure management, diabetes control, smoking cessation, and social engagement often have a greater impact on long-term health than many people realize. Prevention is not always dramatic. Most of the time, it's quiet, consistent, and powerful. Let me share a story that perfectly illustrates this point. Several years ago, I met a gentleman named Robert, who was 74 years old. He arrived with a thick folder filled with screening reports, scans, and test results collected over many years.
He was diligent about his health and believed that more testing meant better protection.
Yet despite all those screenings, his blood pressure remained poorly controlled. He rarely exercised, and he struggled with sleep. During our conversations, we shifted focus. Instead of pursuing every possible test, we concentrated on improving the basics. He began walking daily. He worked with his healthcare team to manage his blood pressure more effectively. He improved his sleep habits and gradually lost weight. 1 year later, he felt more energetic, his numbers improved, and his confidence returned. The lesson was powerful. Sometimes the biggest health gains come not from finding new problems, but from consistently addressing known ones. If there's one message I hope you remember from today's discussion, it's this: the best healthcare decisions are personalized healthcare decisions. A screening that helps one person may not help another. Age alone should never determine medical choices. Neither should fear. The most effective approach combines evidence, individual risk, personal values, and thoughtful discussion with a trusted healthcare professional. As we've explored today, prostate cancer screening, whole body scans, carotid artery screening, overly frequent bone density testing, and certain cancer screenings in advanced age can all involve trade-offs that deserve careful consideration. The goal is not to avoid screening. The goal is to understand when screening is most likely to help and when it may offer little benefit while creating unnecessary risks. I would love to hear from you. Have you ever undergone a medical screening that left you with more questions than answers? Or have you had a screening that helped detect an important problem early? Share your experience in the comments below. Your story may help someone else make a more informed decision. If you found this discussion helpful, consider sharing it with a friend, spouse, or family member.
Many people assume more testing always equals better health, and understanding the full picture can make a tremendous difference. Thank you for spending this time with me today. Stay curious, stay informed. Continue asking thoughtful questions about your health. Small conversations today can lead to better decisions tomorrow.